Hello, I'm Abhijit Barve, Chief Medical Officer for Viatris. Welcome everybody to this virtual chat focused on mental health care and NCD Academy. I'm fortunate to be joined by two colleagues from the field of mental health, Dr. Rana Parekh, Chief Diversity and Inclusion Officer for American College of Cardiology, who is also a psychiatrist by training, and Dr. Afzal Javed, President of World Psychiatric Association and a consultant psychiatrist. Today, we will focus on the importance of mental health, challenges with care following the pandemic, and the importance of education, as well as educational resources that can benefit healthcare professionals globally. So my first question today is really to Dr. Parekh. If you look at it, NCD Academy has really come a long way since its inception and has become a go-to place for NCD education. Could you provide some insights in terms of where NCD Academy is heading, especially in the mental health arena?
Thank you, Dr. Barve, for that introduction and for that very important question. Maybe as a way of background, just to let me tell you a little bit about the NCD Academy. It's a year and a half young, and already we've had over 10,000 users globally. It's a free educational opportunity. It's web-based, it's interactive, and our hope is that it will continue to grow and engage healthcare professionals globally. This new course on mental health really does quite a few, I think, positive things. First, it destigmatizes mental health, which we know is a primary issue in terms of challenging people to actually get care, and also for providers not asking important questions. Following the pandemic, and as we see countries around the world coming out of the pandemic, we're starting to see more and more cases of mental health issues. And so this is really timed well to help globally our healthcare professionals ask important questions. How to ask them early is important in mental health. And I think this is going to be something that the NCD Academy is really going to highlight. When we think about health equity, which is another issue that the COVID-19 pandemic has talked to us about and revealed, is that we see that there are geographical and economic challenges in terms of bringing a level playing field to education. And the NCD Academy is free. It allows for people around the globe to access tools around mental health. These courses will not only talk about the literature, but it's also going to provide pragmatic skill sets, screening tools. We know with mental health, similar to other disease states, it's important to ask good screening questions and to get early treatment available early. It's a case-based learning, so we know that healthcare professionals oftentimes learn better with case examples. There's going to be also an opportunity to see how techniques can be operationalized in the primary care setting, which also makes it very real and I think very informative. We're delighted that the NCD Academy is partnering with Viatris as our primary funder and sponsor. And in this particular course, we're collaborating with the World Psychiatric Association.
No, I think that's a great kind of insight in terms of how it has transformed and how this course is going to be kind of be that starting point. But I just wanted to kind of get a little more insights from you in terms of how a program like this can really drive action, because at the end of the day we want to make sure that we are able to really leverage these courses to maximize its impact, and it could provide that support healthcare professionals need in terms of how they're approaching the mental illnesses in their patients. Because it's one thing about having this program, but I think the most important part from my perspective is really how we can make sure that it goes to folks and make sure that we are able to take care of these inequalities.
What's amazing about the primary care provider, the general practitioner, which is where the NCD Academy aims and focuses its attention, is they are the most trusted person for people. I think outside of your family and community leaders, people will talk about this person as being very critical. So there's an opportunity to really affect change, not only at the individual level, but really by improving access to early prevention and to really improve access to quality. As I mentioned earlier, this is an opportunity to really cultivate confidence in the general practitioner on mental health comorbidities, and by giving screening tools and showing how techniques can be actually used in their office, it really will set them up for success with their patients. But the goal, as you know, as you're alluding to, is much greater. You know, it's really helping people integrate all aspects of healthcare and thinking about the patient holistically.
I think my next question is for Dr. Javed, and I think this is something which always keeps coming up, right? And you know, people are educated. You know, despite all the education, most people still equate mental health with mental illness. This is kind of a historical question. How would you describe the differences between the two?
This is actually the most important aspect of understanding mental health, mental illnesses, and mental well-being. You are absolutely right when you say that because of stigma, because of many other underlying variables, people always consider mental health as equivalent to a mental illness. Mental well-being is equally important. And we understand that now, in addition to the treatment and management strategies, every profession is focusing on prevention and promotion. And mental health particularly is important because unlike many other specialties, it is not only dealing with the professionals and patients, but also with the families. And there it comes the concept of mental well-being, the concept of promotion of good mental health, and the preventive aspects of promoting the best in terms of a quality of life, which is full with good mental health. Now, the other thing which I want to emphasize, and World Psychiatric Association is taking this as a priority, that we believe that mental health should be perceived and conceived as public mental health. Because when we will say we will include public mental health as our agenda, then the concepts of well-being will be highlighted a bit more.
No, I think this is really a wonderful answer. I mean, I think it also highlights how much more education and how much more awareness is needed to ensure that we are really able to make an impact here. I think another question for you is that, you know, we are seeing with this pandemic, you know, as we are moving into this next stage of pandemic, as people are calling it, at least some of the countries are lifting the COVID restrictions, right? I mean, it's not happening across the globe equally, but in some countries, definitely it's happening. And, you know, many of these patients probably have not got adequate care in the past 15 to 18 months. As you know, how can mental health professionals help their most vulnerable patients as we open up in this pandemic?
Unfortunately, the isolation, the stigmatization, and then restriction of resources has really affected mental health in a big way. We are seeing a lot of burnouts. We are seeing a lot of issues that may not be directly related to COVID, but those are directly related to COVID in terms of the future care. So I think mental health, unfortunately, was not given a priority. And with this COVID, our problems, our difficulties have increased, and mental health is going slightly at a sort of at the back when we compare to the general health and social care problems. And I only want to emphasize no health without mental health. And especially when you are undergoing stresses, issues, problems, I think there should be a lot of emphasis on preserving, supporting, and helping for mental health problems.
I want to go back to some of the things that Dr. Javed brought up, because I think great points he made, and his perch from being the president of the World Psychiatric Association, I think gives great insight into how much the NCD Academy can really do a great work. Dr. Javed talked about stress. If there's something that we all have shared this past year, no matter where we live, if it's India, if it's the United States, wherever, it's stress, either to a greater degree or less of a degree, or even vicariously. So we've seen things that have happened. And we know that stress, if it's not mitigated, if it's not first recognized, and I think the NCD Academy really highlights stress under the larger umbrella of mental health, but that we can see in stress states, decreased immune systems. Maybe those are the people who have been more vulnerable to COVID and more communicable diseases. But we also know at ACC that stress can lead to hypertension, arterial damage, pro-inflammatory states like increased C protein. And we know that this is probably the case across the other disease states. I will also just say one other thing about the NCD Academy. I've had the privilege of looking at the resources. Again, it's such a wonderful way of seeing what you can actually do. It gives you a model on what you can do with a patient right in front of you. So often people steer away from mental health, not only because of the stigma, but because they also don't have the words. They don't know how to have compassionate conversations. They probably already do it. They just don't realize what they're doing is actually very much informed by what we've learned in mental health. So I think it will do so much service globally. I think it will bring confidence to cultivate the next generation of healthcare professionals who will think about the patient holistically, will think about underlying and comorbidities, and really, I think, take us to the next level in terms of providing equitable care for everyone.
And I think the response it covers a broad gamut, as I call it, right? It's not just the patient, it's the healthcare professionals. Means, they have seen, sitting in those PPE suits for hours together, or being in that isolation, or being comforting a patient who is unfortunately not going to make it. I mean, these, you can understand, what they have gone through, especially the frontline workers, whether it be nurses, whether it be physicians, respiratory therapists. So, it's not just remaining to the patients anymore. It has extended well beyond the impact that we have typically seen, what we would have typically seen. So this is a completely new chapter for all of us. But thanks for that comprehensive answer. Just another question for you, Dr. Javed. As a consultant psychiatrist and a president of WPA, how can initiatives like NCD Academy help improve mental health?
This is very important that we are extending and expanding the mental health education and the mental health teaching and training to our colleagues who may not have an accessibility in terms of while they were having their training. I mean, I always say that you just look one example of medical students. You ask anyone, any psychiatrist, it could be hardly under 5% of the medical students who would have chosen psychiatry. So what happens about the 95%? They have not been exposed about the mental health problems or dealing with the mental health issues. So I think these courses will actually fulfill that particular deficiency or problem which we have, all of us or many of us have experienced during our undergraduate and postgraduate medical training. So this is one aspect. The second aspect is by promoting and by propagating about the importance of different domains of mental health, we are also going to reduce the stigma. And I always say that we talk about stigma among patients or families. There is a big stigma even in the medical profession. So the best way, and this is a great initiative by Viatris, NCC, and the ACC, by bridging the gap, by making the information, the teaching, and the training in such a simplified way that people not only enjoy, but they also learn a lot.
I mean, so true, right? I mean, when we were learning as medical students, how much did we learn about psychiatry other than, and it is such an important component of a person's complete, holistic well-being that, it gets lost. But I think hopefully these courses like this and ensuring that people are able to utilize them appropriately will definitely expose them and fulfill that unmet need, as I could call it, in terms of where we need to focus on, and it's becoming increasingly important. So absolutely. So thanks for that response. My final question for Dr. Parekh, so we started off with cardiovascular, right? We moved to cancer care, and now the mental health is the third big five, as we call it, NCD, that is covered by NCD Academy. How can we continue the progress, in mental health care globally? And what is really next for NCD Academy in terms of, we've covered a significant part, but what do you see as the next steps here?
You're right. The NCD Academy has started with cardiovascular diseases. We've talked about cancer, mental health. I'm so delighted is the third. We're going to be looking at chronic respiratory diseases. We're going to be looking at diabetes. The theme today has been around what COVID-19 has probably done for us in terms of challenges, but I think the other opportunity, as I'm talking to two other physicians, is that maybe we shouldn't be demarcating things so clearly as transmissible versus non-communicable. We know that COVID has really shed a light on how much of an interplay there is with regards to so many underlying disorders or potential disorders and individual risk factors. And so I hope this theme will continue about comorbidities.
I just want to thank you, Dr. Parekh and Dr. Javed, for this engaging chat. As we know, there is no health without mental health, as you rightly mentioned. As a kind of a new kind of a healthcare company, Viatris is extremely proud to sponsor the NCD Academy as part of our mission, which is really to empower people worldwide to live healthier at every stage of their life. At Viatris, we understand the stigma and other challenges that are associated with mental health conditions, which can affect anyone, anywhere. The NCD Academy is making great strides to addressing these challenges. And so I really want to thank you today, and thanks to the audience for tuning in. Thank you.
Thank you very much.
Thank you.